One of the first studies, this was the ketone infusion study out of Sweden, where they looked at patients with heart failure, reduced ejection fraction, and infused a ketone salt, a beta-hydroxybutyrate salt, into these patients. And you can see rapid elevation in their circulating ketone levels. And amazingly, when they looked at cardiac function, then you get this dramatic increase in cardiac output. So and it's kind of a dose response. So you can see the upper right bar graph there showing increase in cardiac output as a function of elevation in circulating ketones. So the greatest effect was at, is that 3.3? I can't see. But increase in cardiac output with higher levels of ketones, greater increase in ejection fraction, and there's a vasodilatory effect as well that has been observed in most of these studies. And another interesting part of this study is they did the same experiments in healthy controls with no heart failure and showed the same effect. So this wasn't just working in people with a defective or impaired heart function. It actually is a very robust effect that occurs across the spectrum from health to diseased hearts. So we now have a couple studies looking at exogenous ketones as the method of elevating ketones, and one was, this is in healthy participants using the ketone ester, or the product from human. You'll notice increases in ketones are very similar to the ketone infusion study I just showed you, so a little over 3 millimolar. And this is showing the improvement in cardiac output with that acute elevation from ketone supplements. And then this is even more fresh off the press. I think this was published just in last December. Again, 20 healthy adults. This particular supplement was ketone aid. And again, ketones, I guess, maybe not quite as high here. They got a little over 2 millimolar with a single dose of this particular exogenous ketone. And then you can see it on the right, cardiac output progressively increasing over time. And then, of course, if you look at cardiac output as a product of stroke volume and heart rate, you see it's contributed, both are contributing to this increase in cardiac output. In this particular study, the heart rate is actually driving more the increase in cardiac output than the stroke volume. We did kind of a pilot preliminary study similar to the two previous projects I just showed you, and we're studying the ketone ester from Juvenescence, which is this was the older version, the C6 diester, and again, single dose delivery of this particular product to healthy subjects, and then serial imaging and blood draws after that. So we've just finished this study. We're close to getting this packaged up for submission. So these were presented last year at an imaging conference, but otherwise unpublished. So we get a nice increase in ketones, which is no big surprise. Takes a little longer for this C6 diester to elevate ketones, so it's a little more gradual, but by 2 hours we're at over 2 millimolar, and get a little bit of a glucose lowering effect with that. But the cardiac output data are very similar to those previous infusion and exogenous ketone studies, so we're seeing a highly significant increase in cardiac output. And we did use a placebo as well, a calorically matched placebo, fat-based placebo, and we didn't see any increase. So this was kind of one unique aspect that we added in addition to the advanced imaging. So this wasn't just an effective food intake and caloric intake that people have seen. Now, if you look at the heart rate and stroke volume aspects of the cardiac output, again, it's both are increasing, so there is a sort of a chronotropic and inotropic effect both going on here, increasing as a function of elevated ketones. And then we also do a measure of myocardial blood flow, and that increase similar to what's been shown in the infusion studies.